So if you haven't been to the dentist in a while, welcome. We know that people get nervous and kind of fear the unknown. We want them to feel relaxed. And so come in, let's have a look at things and kind of build a game plan. You don't want to wait till something hurts or something breaks, right? That's not any better. So come in, let's just have a look and see what we can do to help you out. I think we strive our best to be very conservative in terms of treatment that we do, focusing on prevention, education, helping people understand some of the things that they are not realizing. And we've learned over the years, that a lot of things that we were taught in school is not actual, how it is in reality. And so we try our best to do things that are really for patient care. I think it's just everything in general, just from the front to the back and how they feel cared for. When we're focusing on, their pocket costs, and when the procedure is happening, they just feel more at ease because we're very clear. We give them the sense of control, and so that's what people fear most, is that they've lost control. When you open your mouth and you feel you're stuck. I think a lot of times people think about finances, and I afford to do this. So, when we talk to patients about a situation, we start off with the finances and we look into the insurance, see what they're covered for. We kind of give them a cost breakdown of what they would need. And we go through all the different options. And, I will even say sometimes one of the options you can do is do nothing. You don't have to do it. And so we give patients the ability to understand that sometimes things can be done now, sometimes things can wait for later. My mentor always taught me, treat people like people. So, do the little things, right? Make sure their head's comfortable. We have a TV in front of the chair so that it helps you kind of feel a little bit distracted from the procedure. If you have dry lips, use some Vaseline, having a bite block so that you're not straining to keep your mouth open the whole time, things like that. So we always try and focus on the little things to make patient comfort kind of a top priority. Well, a lot of patients get referred to specialists for certain things, such as an old root canal that got reinfected. We know how to treat those and correct those. Pulling out wisdom teeth, lots of kids that have crooked teeth and need to go see a specialist for alignment. We know how to try and do early prevention, and especially with patients that are nervous. We do oral sedation at our office that helps to make them feel at ease so we can get the procedures and make them feel more calm. Not really. I kind of love everything. And I believe that people aren't cookie cutters. So by being able to do all the different procedures, it just helps me to take care of a person as a whole. I think there are many wonderful offices, and we just want to be an office that is clear, that communicates well, trying to help your dental needs with sound advice, and we try and do things with excellence.